Hello, everyone. We're going to start this part of our immunity concept on hypersensitivity. So here again, you have your module in LMS in the folder. So I encourage you to refer back to it as far as your learning outcomes. And then what we're going to do is talk about hypersensitivity. When you think about hypersensitivity, you have to think about allergic reactions. And allergic reactions and hypersensitivity go hand in hand, and we'll talk about the multiple different kinds of hypersensitivity reactions. So there is a website that I will include in your PowerPoint that is up-to-date information. And on your module, there is a website also called FARE, F-A-R-E, and it talks about food allergies. Lots of great information. So when we talk about the concept of immunity, we're also going to include inflammation in this one as well. When we talk about here, the definition of hypersensitivity is defined as your book as an overactive immune system with excessive inflammatory responses occurring in the presence of antigens. Now, if you've watched your immunity PowerPoint presentation first, which I encourage you to do, if you are here in hypersensitivity first, stop and go back to immunity first. So in the presence of antigens, those are the foreign bodies that are attacking the body. So the immune system kicks in and tells the body, okay, we need this specific type cell and we need this to happen so we can stop this hypersensitivity reaction. But as nurses, you're going to learn what to do in case a hypersensitivity reaction occurs. So hypersensitivity, again, think of allergic reaction. So hyper, break the word apart, means excessive. That's in your definition. And stimuli, antigens that we can put in that category could be anything, and we'll talk about these: food, bee stings, contact, think about your latex allergy patients, and certain medications. That's why it's so important you learned in 117 and 111 and 215. When you ask a patient their name and date of birth, the second thing you should ask them, are you allergic to any medications? Always, always. So here we see a child that is having a little runny nose. And with her little runny nose, she does one of these things. So when we think of hypersensitivity reactions, we can have mild to very sensitive. There is going to be a video and on your PowerPoint presentation that you're going to look at that's going to have a wake-up call Heather's story, and you'll look at it on your own time and you'll see what Heather did and her reaction. So there's our little fellow that sneezes. Antigens, we've said that word over and over. If you are in hypersensitivity PowerPoint presentation, stop here. Go back to the immunity presentation. I encourage you to watch it first. So antigens are those substances capable of stimulating an immune response. Those are the things that are attacking the body. And here we have listed, our immune system recognizes them as substances that are foreign. There can be chemicals, bacteria, viruses, pollen, things we mentioned earlier, and they're trying to wreak havoc on the body, and the body has to stop it. Sometimes it can, and sometimes it cannot. But what the body does when it's first exposed to something that it's allergic to is it builds and creates antibodies. We talked about that in the immunity PowerPoint presentation. An allergy is something that you are hypersensitive to. It's a foreign substance. Again, we'll say drug allergies, food allergies, and contact allergies. And some people have mild reactions, a runny nose, they sneeze, they have some watery eyes, and a little bit of itching, not a whole lot. And we see those more in seasonal allergies than we do anything else. So think about, again, when you ask your patients, are they allergic to anything? Do you need to know what kind of reaction they have? Hopefully you said yes. I myself am allergic to penicillin. It makes me have huge hives and it makes me feel like my airway's closing. So I cannot take penicillin, but you also have to be mindful that cephalosporins can be an issue with people who have penicillin allergies. So here is my forearm. This is what a wasp does to me. This is almost 24 hours later. I was driving to work, was on call, jumped in the car, got to get there, working in critical care. And the next thing I know, I feel something crawling on my arm. I look down and pop, the wasp stings me. Of course, I panic. And I didn't realize that I was this allergic to a wasp sting. As I'm driving and panicking, I stop my car, I get out to swat the wasp off so I don't get stung a second time. So it was a frantic moment. Luckily, I was going to the hospital anyways. And whenever one of the pulmonologists saw my arm and saw it, how it made me short of breath, he said, "Don't you think you need an EpiPen?" So now I have an EpiPen that I carry around with me just because of this reaction. It got worse than that. So an allergen are antigens that trigger excessive inflammation or immunity. So antigen is the foreign body. Allergen is a very similar word that we can interchange. They can be inhaled, ingested, injected, or you can come in contact with them. Reactions can range from mild, which can be annoying, to severe, which can cause sudden, life-threatening reactions called anaphylaxis. And you need to know what to do in an anaphylactic type reaction. Causes of allergic reaction, you see here pictures. I listed penicillin, I listed this wasp. I also am allergic to peanuts. Luckily, I'm not allergic to dogs or cats, but cats' dander does make my nose itch. So here again, triggers that we can think of are things that can cause allergic reactions. I'm going to go down my list. You make your own list. Pollen, mold, latex, different plants, poison ivy, poison oak, grass. My daughter's highly allergic to grass. Trees, certain weeds, foods such as pineapple, peanuts. Who would be allergic to chocolate, but it's on the list? Dairy products, certain sweeteners, cheeses, animals, and sometimes people are allergic to that lick from the animal, the protein that's in their saliva. Cats, dogs, dust mites, bees, wasps, roaches, and certain medications. One of the big medications that people are allergic to that you will see when we talk about angioedema is ACE inhibitors. Let's talk about hypersensitivity one more time. The most common type of allergic reaction is hypersensitivity type 1. It's called an anaphylactic reaction. Now, when these reactions happen, they can be localized in the beginning and then become systemic before it's all over with. When we say localized, they can remember the bee sting on my arm. It did make me short of breath and it did make me hoarse. So that was affecting my airway. Systemically, it can cause huge hives, angioedema, which we're going to look at a picture in just a minute, And it can make you short of breath. It can make your tongue swell up so much with that angioedema that it blocks your airway. But the goal of this type of hypersensitivity 1 reaction is to prevent the reaction, stop the antigen, and early intervention. So let's talk about the 4 types. We'll classify them in order of type 1, which is your anaphylactic. And then type 2 is your cytotoxic reactions, which is mostly your blood transfusions or blood products. Type 3 is your immune complex mediated reactions, your autoimmune disorders, rheumatoid arthritis, lupus. Those are not just the 2, those are the 2 that you're going to learn about. And then type 4 is more of a delayed type T cell, back in your immunity presentation reaction. Contact dermatitis, TB skin test. Me, is allergic to that TB skin test. I can no longer take the TB skin test because it makes a huge welt on my arm and gives a false reading. So your patients that are allergic to TB skin test have to have a chest x-ray to say, we don't have TB. So type 1, you need to know that this is the most serious hypersensitivity allergic type reaction. It's immediate, it happens rapidly, and it forms an immunoglobulin, IgE. We talked about that in the immunity presentation. It causes excessive inflammation, your hives, your swelling, an overreactive immune system. You remember those kinins that were released in the body, making it hard for our blood pressure to stay up? And usually the target of the action of the allergic reaction is appropriate to the responses being excessive. Anaphylaxis, you'll see angioedema and hives. So in this PowerPoint presentation, in the notes section, I have included several videos for you to watch that will help you with hypersensitivity type 1 reactions. So think hypersensitivity of being rapid, sudden onset, immediate, and you need to be able to react quickly and know what to do. When your patient comes in and they're presenting with signs and symptoms of hypersensitivity type 1 reactions, you need to know what to do, as I said, and we're going to go through that. So here, earlier, we started with the mild symptoms, and the mild symptoms on the right side of the screen include itchy, runny nose, sneezing, mouth, itchy. Some people say when they eat a certain food, their mouth becomes itchy, their tongue, the roof of their mouth. Skin, you'll see a few hives and a mild itch, not terrible. And the gut can get nauseous and have where your stomach, because of the way your body works, can cause you to have diarrhea. So when we talk about mild reactions, those are the mild reactions. Then we talk about the severe. When we're talking about hypersensitivity type 1 reaction, anaphylaxis, your folks are going to present with these symptoms. Any of these. Not all of them, but any of these. Shortness of breath, wheezing, a repetitive cough that's hard to stop. Remember the website that I showed or have shown you, that FAIR? This is their website picture. When you're having an anaphylactic reaction, severe symptoms, your heart, your color becomes pale. You can become blue because you're short of breath and you're not getting enough oxygen because your airways swelling shut. You can become faint because your blood pressure drops. You have a weak, thready pulse, and you can get dizzy. So just remember, the heart can do lots of different things. Your throat can get tight, you can get hoarse, you have trouble breathing, and you have trouble swallowing. So here, let's put on our thinking caps and think about, would you give somebody that's having trouble breathing and swallowing a PO medicine? Absolutely not. So in this severe symptoms, their mouth can have significant swelling. We'll see pictures here shortly with the tongue and or lips. Skin, many hives all over the body, widespread redness, the gut, repetitive vomiting, and severe diarrhea. And other symptoms that you can see are impending doom, feeling like something bad is fixing to happen, anxiety, and confusion. So this is a good slide to refer to with mild symptoms and severe symptoms. Can mild symptoms lead to severe? You betcha. They certainly can. Another slide from FAIR. Here it says, what do we need to do? So this is a refer to slide. It is a review slide. What can we be allergic to? Over here on the left side of the screen, latex, bee stings, medications, seafood, peanuts, milk, wheat, you gluten allergy people, and eggs. So anaphylaxis, shock. We're not going to talk about shock. We're just going to talk about what to do in case somebody has an anaphylactic reaction. What are we going to do first? First thing you're going to do is remove the agent. Get rid of it. And then here's your symptoms again. And your actions have to be immediate when taking care of these people. Okay. I said the word earlier, angioedema. Angioedema is the swelling of the deep layers in the skin and other tissues in the body. So on the right side of this slide, it shows the face, the groin, the hands, and the feet. Those are not just the areas. The biggest area is the face, lips, mouth, and tongue, because those are the areas that are going to affect the airway. You will see these people, their face swell quickly and immediately, and your priority in this situation in angioedema is to protect their airway. So look at this lady. I'm not sure what her allergic reaction was to, but these are the folks that I have seen in practice that have taken an ACE inhibitor. Their tongue and their lips swell up. And when you see these type allergic reaction, hypersensitivity, and this angioedema occurs, you're going to see it more in the face, and that's, you got to be able to act quickly. Take action. Symptoms of angioedema, most common is swelling. We just said face, mouth, discoloration patches on the skin, which are your hives, rashes, and some people will complain of paresthesia, tingling. And what you need to do is to get them to the emergency room ASAP. Call 911. If you know that you have anaphylactic reaction, as soon as you inject your EpiPen, you need to be calling 911, because what can happen, and you'll watch this in the videos as well, you inject your EpiPen, and a few minutes, 15 minutes or so later, your symptoms can come back. So that's one of the reasons that you need to get to the emergency room. Respiratory distress, we need to protect the airway. So type 2 cytotoxic hypersensitivity reaction, as I said earlier, is your ABO incompatibility, your transfusion reactions. These include hemolytic anemia and immune hemolytic anemias, immune thrombocytopenic purpura, and hemolytic transfusion reactions. What I want you to remember about type 2 is ABO incompatibility, a blood transfusion reaction. How do we prevent it? When you give blood and you learn to give blood, which all you can do at this point in your school career, nursing school career, is you can observe. But it is thoroughly checked with multiple people, you in the lab, and you bring it upstairs, you and the other nurse, RN, check it at the bedside. You identify with the patient and ask them if they have any allergies. Have they ever had a transfusion reaction? And you need to know what to do. What would you do if you hanged a unit of blood and your patient started complaining of shortness of breath and itching? You better stop that blood. Type 3 hypersensitivity reaction is the immune complex reaction. And these are because there are excessive antigens causing immune complexes to form in the bloodstream. So think of your patient with RA, rheumatoid arthritis. That is our little patient here in the lower part of the screen with the joints that are very, very swollen. So these immune complexes are floating around in the bloodstream and they get stuck in certain areas. RA is your joints, and they cause and wreak havoc. Another type of immune disorder is SLE, systemic lupus erythematosus, and lupus, short, is this picture on the lower right corner is the person who has the butterfly rash. Not only just that, across their face, but that is the telltale sign to see if someone has lupus. When these two type immune disorders happen, they can cause kidney damage, they can cause rashes that are abnormal on the skin, and wreak havoc on joints. With lupus, you will learn that kidneys can be affected very quickly, and that is something good to remember. And the big thing about immune complex type 2 hypersensitivity is tissue integrity. Type 4, delayed reactions. Hypersensitivity is cell-mediated. Now, think of the person, or I would think of the person who would have a reaction to PPD TB skin test. That is the bottom picture. That is an abnormal reaction to a TB skin test. Some people have this type reaction delayed with metals from jewelry, and then just contact dermatitis from poison oak or poison ivy, which is the top picture. And fortunately for these folks that have these type reactions, they only last 5 to 7 days unless you have an overreactive immune system, and then you have to start treatment, which would be steroids. Hypersensitivity reaction types. So let's review. The acid, ACID. Type A is type A. Type 1 is A. Anaphylactic, the most severe. Type 2 is cytotoxic, so that would be C. Type 3 is the immune complex mediated, which would be I. And 4 is a delayed hypersensitivity type reaction. So here's a question. So which statements regarding type 3 hypersensitivity reaction is or are true? So I want you to think about these, and I want you to read through them, and when we meet in class, we'll go over the answers. Let's look at some things when we talk about hives. Are hives the same in everyone? No, absolutely not. So when we look at this picture, we see these red raised erythematosus areas, some inflammation going on. And here I see tiny little macules, as they're called, raised and probably itchy. And here I see them erythematosus around and raised off the skin. And I would probably say itchy. When we give someone a medication, first-time medications, we always want to watch for rashes or allergic reactions. So another reason that these type rashes can occur are touching something on a surface that they're allergic to, come in contact with plants, latex, animals. Can they get worse? Absolutely. If you treat these, or you treat someone, anytime you treat them, you've assessed them, you've treated them, and the next thing that you should do is reassess to make sure that what you are doing is working for this patient. So look at this fellow over here on the left. It's hard not to look at the lady on the right, but we're coming to her. So one of the things that hives cause, and you'll hear this word, medical word, mentioned when you see somebody covered, like this little fella is urticaria. when it itches so bad and it's hugely covering areas of the body. His whole trunk, his armpits, and I bet you his groin is covered with this type rash. Urticaria, Urticaria. It's caused by all these hives, which is red as raised. It's a larger area. And then the lady on this side, what do we call this? We talked about it just a second ago. Hopefully you said angioedema. So swelling in her eyes, swelling in her lips, and I would have to be able to see in her mouth to see if her tongue is swollen as well. So let's talk. I'm going to give you a little story. One of the nurse managers that I used to work with was allergic to pecans, tree nuts, almonds, cashews, and we were in the cafeteria. She knew she was allergic to them. And the person who was making the salad was, I'm going to say, double dipping her gloved hand in different containers. And guess what was on the salad bar? Pecans. So when they made this nurse manager salad, they made it, and unbeknownst to her, and something she said she didn't think about later, is that this person who was making the salad did not change her gloves in between clients or people who were walking up to get her salad. So she got contact from the pecans, even though she did not have pecans on her salad, and had an allergic reaction, had to inject herself with epi. Luckily, she was at the hospital. So here we can see in these two pictures, I see on the right side, what do you see about the hand? What's the difference? We got two, so we have to always do symmetry. I see a lot of swelling, maybe some contact. And what do I see here? This is allergic reaction to a medication called penicillin. And here we see some more hives. I see some swelling in this kid's face. I'd keep him around for a little while longer just to watch this and protect his airway. And this lady here is your typical ACE inhibitor angioedema of the tongue. I have seen people this way, and I have seen people end up with a trach because of this situation of all this angioedema and around their mouth. So we talked about hypersensitivity type 1 anaphylactic reaction. We need to know what to do. We have to take action. So the first thing that you need to do is what? I have mismatched and placed these in not an order of what you need to do. I want you to go to your book and look and read. And then when we meet in class, I want you to have it written down so that you can tell me, what would you do first? What is your priority? And then follow the steps and put everything else in order. What is your first drug of choice when it comes to an anaphylactic reaction? What are you going to do for this client when they tell you that they're short of breath? All right, got some homework. Oops, I don't want you to see that. So then the next thing is on this administering an EpiPen, you will have 3 videos to watch. I encourage you to watch them. They're very short, simple, sweet, to the point, and they're very interesting. One is a group of kids who have hypersensitivity type 1 reactions, and they have to know what to do if they have an anaphylactic reaction and how to give themselves an EpiPen. It's a short 1 minute, 30-second video. Then there's a nurse that talks you through a 90-second video, because we are going to work on administering, knowing how to administer, not giving it to each other, an EpiPen. Y'all may laugh at that, but there's a reason behind what I say when we're not giving it to each other, of course. So in your book, here's some more homework. I want you to watch the videos, and I want you to know how, because you're going to demonstrate to me to administer an EpiPen, because you're going to have to teach somebody one day. Clinical judgment. We have a 45-year-old patient. He's in the hospital, type 1 diabetic, and he's got a facial abscess close to his eye, and he's going to be getting ceftriaxone IV. And he has a health history of hypertension and osteoarthritis of the left knee. He has an allergy to peanuts, tree nuts, and penicillin. He's married, has 2 children, works as a full-time 3rd grade teacher, bless him. And he has just finished his lunch. He has IV normal saline hanging. And somebody started his ceftriaxone while you were at lunch. Thank you for that person who did that for you. But the client calls out shortly after the infusion had started of the antibiotic. He's complaining of dizzy, shortness of breath, and itching. As the nurse, you enter the room, your CNA has done the following vital signs for you. Your oxygen set is 86%, good, bad, or ugly. What are you going to do about that? Your blood pressure is 94/50. Your patient's blood pressure is. His respiratory rate's 34 and his heart rate's 110. When we meet in class for our activity, I want you to have a plan. I want you to tell me what you're going to do for this client, and we're going to discuss it. I also have a poll everywhere, which I think are very interesting and fun to do, about hypersensitivity reactions, which we will do in class together. And then the last 3rd part of your homework, or 4th part of your homework, is going to be with the client that you just taken care of, this fellow here. I want you to tell me what's your priority number 1. I say nursing diagnosis, but your priority problem, what's your goal going to be? And I want you to have at least 3 interventions for each of your priority problems. If you have more than 2, list them, and then we'll discuss that client. All right, so that is hypersensitivity type 1 reaction. So you have some homework to do, an activity for class where we will discuss your activity. Part of it's going to be before you meet with me in class, and that is going to be, I'm going to go back. So write your homework down. Is slide number 27, the slide where you have to put in order of what you're going to do for this client. It's actually slide number 26. The answer is on slide 27 in mine. So on slide 26, your anaphylaxis take action slide, put in order, and write out why you're doing what you're doing and why you're doing them in the order that you're going to do them. Then you need to watch the videos, number 2, and write down how you're going to teach someone to administer their EpiPen, because we're going to do that together. And then our clinical judgment slide with our 45-year-old who's going to get ceftriaxone. And with this fella, I want you to tell me what you're going to do for him. What do you think about your vital signs? And I want you to have at least 2 priority problems with goals and 3 interventions. And then there's another question, and then we'll do poll everywhere together. So you got some homework. You got some research to do, some videos to watch. And part of this will be when we do activity day, I will see and you'll show me where you've done this work so you can get credit for it. So I want you to do it. All right. End of this one. Recording's going to stop. Again, Ms. McCarg always says, if you have any questions, contact me, email, come to my office, come see me, grab me, and ask. Earlier, sooner than later. All right. Get to work.